In this module, we will discuss the steps taken to add training patients to a rapid plan model. Before adding patients to a model, it is necessary to create an empty model in the Model Configuration workspace. Select New in the upper left corner of the screen to create a new model. At this point, you can name your model. We will name our model Prostate Model. You can then create a description for your model that might detail types of patients included in the model, such as model trained with intact prostate and prostatectomy patients, or any other useful information. The next step is to select the anatomic region. For example, pelvis would be selected for a prostate model. Finally, you can select the structures that you would like to include in the model. The structures selected in this step include the targets and any organ at risk that you would like your rapid plan model to create an estimated DVH for. You can add up to 3 targets to a rapid plan model. For the PTV in this example, we will add PTV high risk, PTV intermediate risk, and PTV low risk structure codes and map them to a single structure. Multiple PTV types are needed in the prostate model because it includes all 3 types of patients. I will now name this structure ID PTV. Using a standard naming scheme can be useful for consistency in your clinical database and across multiple institutions. Let's now add the rectum, bladder, and femurs. It is important to note that the system will automatically name a structure based on the standard naming scheme published in the Red Journal by Santana in 2012. If you would like to change the structure name, you can create a new structure ID that is unique to your clinic. Please note that when the PTV was selected, it defaulted to a target structure. You will need at least 1 target structure selected in the model. Select Save to save the model. Once the model is created, you can then proceed to External Beam Planning workspace to add training patients to the model. You should already have a list of pre-identified patients to add to the model that satisfy the criteria discussed in Module 1. Open the first patient to add to the rapid plan model and select the correct treatment plan. Navigate to the Planning menu and add Plan To Dvh Estimation model. Select the DVH estimation model that you created in the Configuration workspace and enter the prescription dose for the treatment plan. For this model patient, we will be entering 79.2 gray for the prescription, corresponding to the clinical prescription for an intact prostate treatment. Then map each model structure to the corresponding structure name in the current treatment plan, while validating all auto-mapped structures were associated correctly. Any unmapped structures needed for this model are indicated at the bottom of the window. Once all structures have been mapped, select OK, and the relevant patient and plan data will be extracted and added to the model. Continue to follow the same steps until all identified patients have been added to the rapid plan model. A minimum of 20 patients containing all modeled structures is needed before you can train your model.